Hey y'all, my name's Frida. I'm a sexual health educator at the Young Women's Resource Center. And today we're going to be talking about birth control options and just like safer sex practices in general. So a lot of the time when we talk about sex, when we talk about birth control, it's usually coming from like a pregnancy prevention sort of lens. And while that's really important, we also recognize that not everyone who is sexually active is engaging in behaviors that could result in pregnancy, right? So not everyone who is engaging in sexual activity is engaging in penetrative sex, like penis and vagina sex. There's a lot of different ways to be sexually active, and we want to just make sure that as folks explore those different ways and become active, that they have all of their options available to them and the knowledge on how to make safe and healthy choices for them and their bodies. So we're going to be talking about a few different options today. Some are going to deal with birth control and pregnancy prevention. Some are going to just be talking about safer sex practices like preventing STIs, sexually transmitted infections, and STDs, sexually transmitted diseases. So we're going to go ahead and start today by talking about dental dams. Dental dams they're not a form of birth control necessarily, but they are a form of protection during sex. So what a dental dam is, they come in different colors and different flavors, and it's basically a really thin sheet of latex. And it helps protect between mouth to genital or mouth to anal sexual activity. So how it works is it just gets kind of draped over the part of the body before oral sex activity. And this thin sheet of latex is what helps protect against sexually transmitted infections and sexually transmitted diseases. So that's an option for folks who are engaging in that type of sexual activity. They are not reusable, so you use them once and you throw them away. We have these here available at the Women's Center, as well as a lot of these other options. So another tool that some people choose to use when they're sexually active is lubricant, or lube. It stands for personal lubricant. And lube comes in a few different forms. So the ones that are safest to use with condoms are going to be water-based or silicone-based lubes. And again, we have all of these available here at the Women's Center. So lubricant basically just works to reduce any sort of friction or irritation during sexual activity. It's like a liquid or a gel, and it can be really great to use along with condoms. It actually reduces the chance of condoms breaking because it reduces the friction on the condom. And water-based lube and silicone lube, they're safe to use with condoms. Can also be used during anal sex. They're safe to use with sex toys or masturbation, kind of all those different options. You can get lube here at the Young Women's Resource Center. You can also purchase it from pretty much any pharmacy or store. And it's really great and safe to use for pretty much any type of sexual activity. Another really awesome type of birth control is a condom. So there are external and internal condoms, and they help prevent pregnancies, but they also help prevent the spread of STDs, sexually transmitted infections, and STIs. So the external condom looks like this. They come in different sizes. The wrappers might be different colors, but basically when you take a condom out, it's gonna be kind of rolled up like this. And it just goes, it's similar to a dental dam. It's really thin, and it just goes over the top of an erect penis. And the way that this works is it's gonna stop any sperm or semen from entering the vagina and the uterus, and that's how it prevents pregnancy. And again, like a dental dam, you only use it once, and then you gotta make sure to throw it away. And that's an external condom. The internal condom is a little bit different. It actually gets inserted into the vagina. So it has this cool little ring to help it go in. And again, it's really thin, and it just helps protect against pregnancy, protect against STDs and STIs by blocking any sperm or semen from entering the uterus and the fallopian tubes to fertilize an egg. And again, one use only. You take it out, you throw it away. These are really accessible types of birth control. So they're free, they're cheap. You can get them from us at the Young Women's Resource Center. You can get them from most stores. There's no age limit in Iowa on who can buy condoms. So you don't have to show an ID, you don't have to be a certain age to buy a condom. And they're really great because they're super cheap, they're super accessible. Really great birth control option for a lot of folks. Condoms are a non-hormonal birth control option. And then there are also options for hormonal birth control. And these are not birth control that you can just buy. You actually have to go to a healthcare provider and get it prescribed, like any other sort of medication. So the way that hormonal birth control works is it actually changes some of the hormones in your body to help prevent pregnancy. Some people choose to use hormonal birth control for other reasons as well, because it can help with especially heavy or painful menstruation. It can help with other hormonal issues like hormonal acne, a lot of different reasons to choose these. It's super important to talk to your healthcare provider about the option that's gonna work best for you and your body, because again, you have all these different options. So the way that hormonal birth control works to prevent pregnancy is the hormones in the birth control actually stop ovulation, so it stops eggs from being released inside the body. And it's also gonna make the cervical mucus a lot thicker, so it's harder for sperm to travel into the uterus to fertilize an egg. So a really popular hormonal birth control option is called the pill. The packs are gonna look like this, and you have to take it at the same time every day, and it's 99% effective. So that means that 1 out of every 100 people that uses this method is gonna get pregnant. So 99% effective, 99% of the time, folks are not gonna get pregnant using the pill. Another option pretty similar to the pill is something called a patch. And the patch is gonna be a pretty small square, and it gets applied every 3 weeks it's kind of like a sticker, it just gets stuck to your skin. And it releases the same hormones just in a different way. So you wear the patch 3 weeks out of the month, and it works in the same way as the pill. It's 99% effective to stopping pregnancy. So the vaginal ring is a hormonal birth control option, and it works in the same ways that the other hormonal options do. It is 99% effective, and it's this flexible ring that is inserted into the vagina for 3 weeks out of the month. And again, just like the pill or a patch, you need a prescription for it from a healthcare provider. Another hormonal birth control option is the shot or the implant. So these are hormones that are released in your body just a different way than the pill or the patch or the ring. The shot you have to get every 3 months, and it goes in your hip or your arm, and it works the exact same way. It's the same hormones, and it works to prevent pregnancy. It can work to relieve heavier menstrual cycles, and the implant is a little bit different. So the implant releases hormones in your body through a small rod that gets inserted in your arm. So it gets inserted through a needle, and it sits between some muscles in your arm, and it just slowly releases a hormone that works the exact same way as the shot, the pill, the patch, or the ring. So it's all 99% effective. So those are some options for hormonal birth control for folks who are interested in that, who might think that that works for their body. Another option is called an IUD. So an IUD is a really small T-shaped device, and it's actually inserted inside the uterus. So this is a procedure that you have to go to a healthcare provider for, and it's the green T-shaped thing that you can see here. That's kind of how it sits in your body. There are hormonal options and non-hormonal options for it, but either way, it's 99% effective. It just stays in the uterus for anywhere from 3 to 10 years. So depending on the type that you choose, it can be a really great long-term birth control option. And when it's ready to be removed, also done by a healthcare provider, it's just pulled out of the uterus through the cervix like that. So it's a flexible, tiny little T. This is how big they actually are, so it's a pretty small device. None of these hormonal birth control options, though, are gonna protect against STDs or STIs. That's kind of more what condoms and dental dams are good for, right? So these help, they change the hormones in your body to prevent pregnancy, to alter menstrual cycles or other hormonal issues, but they're not gonna protect against STDs or STIs, which is really important to know. The other hormonal birth control option is called emergency contraceptive. So this is a set of 2 pills that you're gonna get. This one you don't actually need a prescription from the doctor for. So this is something that you can buy over the counter at pharmacies, or you can come to us at the Young Women's Resource Center and we can help you get it. You can take it up to 5 days after having unprotected sex. And the way that it works is it's gonna prevent ovulation and prevent an egg from being fertilized. So if an egg is already fertilized, this is not gonna work. It doesn't cause an abortion. It just helps prevent an egg from being fertilized after unprotected sex. So there are a few different brands of emergency contraceptive that you can get, a few different options, and it's really important to be aware that different options might not work as well based on your weight. So people who are over a certain weight, I think it's 165 pounds, the hormonal emergency contraceptive isn't going to be quite as effective. So that's something that's really important to talk to a healthcare provider about so you know the best option for you. We have a lot of different options to keep your body safe and healthy. And if you're interested in any of these birth control options, you can come talk to us at the Young Women's Resource Center. You can talk to your healthcare provider, your doctor about it, and they'll help you kind of figure out what is the best fit for you. We also have a really handy chart that you can look at and download that kind of compares a lot of these methods and even talks about some other ones that we don't touch on in this video. So you can look at that chart to kind of see how effective they are, how easy they are to get, and the different steps for procuring these different types of birth control.